Sure.
I think we both have thoughts on this. So stem cell therapy is one of those catch-all terms that sounds really exciting, and is in actuality in its infancy. Um, Stem cells are a great idea. We all know that stem cells are what we all start off with as a embryo and develop into a human, which is phenomenal. It's very poorly understood how that process goes. So real stem cell therapy is either in preclinical or early clinical phases, and is not appropriate for any of the pediatric conditions we're discussing at this point. Will it eventually have a role in eye disease? I think absolutely. Are we close to it? Probably not. So I'm very, I stay pretty on top of, and I know Dr. Capone does, anybody in our field stays pretty on top of where stem cell therapy is and what they're working on and how they're intervening. Not dissimilar to gene therapy, stem cell therapy is pretty targeted right now. What they found, not surprisingly, is that you can't just take a quote unquote stem cell, throw it into a tissue and expect it to know what to do. So they have to be tweaked a little bit. They take some preconditioning to modulate them and get them going down the right pathway, which makes them more selective for a certain disease. Sometimes they're transformed in order to have a different genetic profile. So the short answer is there's a lot of work going towards it. It's a long way off from being useful in the meaning that most people are. And then the other thing that I would warn people is that there is a lot of hype around stem cells. And unfortunately, these tend to be unverified, unpublished studies. And we've all had bad experiences with patients out of desperateness trying one of these stem cell therapies and having bad outcomes. And Tony, I know you have some thoughts on that too. So I'll let Dr. Capone add his thoughts on that as well.
Yeah, so I agree with Dr. Drenser. I think when stem cell therapy sort of started to become a thing at its very, very birth, I think there was a lot of enthusiasm for it and a lot of hype. And, I really think the hype was premature, and to date, stem cell therapy has not lived up to the hype. There's this notion that you can put a stem cell into a tissue and it kind of automatically knows where to go and what to do, how to fix something. And the analogy I'll usually use is, it's kind of like throwing a wrench at a car and hoping the car will somehow fix itself. That's kind of, we're nowhere near applying stem cell therapy for routine therapeutics. It's a much more specific, number one, there are many different types of stem cells. They're not only of fetal origin. We have stem cells in many of our tissues in our body. Number two, stem cells at different phases of their lifespan, are used. They can be very, very primitive. They can be semi-mature, and so forth. And that just gives you a little bit of an understanding of the complexity to stem cell therapy. But the main thing I would underscore is what the point that Dr. Drenser just made, and I'm going to kind of underline it and put it in bold with exclamation point after it. There are no clinical data that support the use of stem cell therapy for ocular disease, for retinal disease in humans. And so, people, that doesn't stop people from trying to market it. And so we have parents who've come to us and either asked us questions or, brought their children for what I would call systemic stem cell therapy, where it's given intravenously or even injected into the spinal fluid, and others who've had direct intraocular injections of stem cells. So if there's no benefit, at a minimum, you could say that the old kind of risk-benefit conversation is purely risk because there's no demonstrated benefit. And kind of to put a point on that, there are a number of reports of people who've received stem cells injected into the eye that have led to blindness. So we want stem cells to work as much as anybody. We're not, anti-stem cell. We are anti, adoption or administration of an unproven therapy until there's enough scientific data to show that the benefit outweighs the risk.
And I'll just add real quickly, because it made me think of it when you were saying that, about that there are, stem cells that are currently existing in adult tissues. And that's going back to the fever discussion we had about universal therapies. That's one of the pathways that we're looking at being able to turn back on, is using it. It's very clear now in the ocular science that within the retina, there are dormant regenerative cells, progenitor cells, that with the right stimulation and modulation can be turned on and reproduce normal growth of capillaries and neurons. So in short, there are some really cool stem cell therapies that are very different than what people think of as stem cells. This is turning on dormant cells that are existing in the eye. And personally, I think that that long-term is going to be a much more fruitful treatment paradigm than trying to take exogenous cells, reprogram them and put them into a tissue and have them work appropriately.
Yeah, so there's lots of things that are attractive about that approach, right? So first of all, they're your own stem cells, so rejection is moot, right? Secondly, they are retinal stem cells. So I mentioned there are other sources of stem cells. Some of the open quote clinics that have offered this kind of therapy, that many of which have thankfully been closed by the FDA, were using adipose or fat-derived stem cells and injecting them in the eye. So, at the moment, I think keep your ear to the ground if you're interested in stem cell therapy. Your, ophthalmologist will be glad to talk to you about them, but be incredibly leery of any kind of clinic offering stem cell therapy to you or your children.